You know, in the Valley, we see the full gamut. I mean, really, from people who would refuse to have an emergency exam because they're scared of what it is. They have this tooth that hurts today, and they want you to look not at the other 30 teeth or 28 teeth. They want you to look at this tooth and take care of this tooth, and we appreciate that. And then you have, you know, the gentleman who was able to retire at 50, and he maybe was a high-powered exec that didn't sleep a lot and traveled a lot and had a lot of stress, and all that took its toll on his teeth and his joints because he was clenching and grinding. And sometimes you need to help people get restored from front to back. And so that would be on the other extreme. I would say most of our dentistry is mainstream bread and butter dentistry, just like I would practice in Nebraska, getting people out of pain, taking care of periodontal disease, fixing cavities before they become a big problem. When they do become a problem, we can do the root canals and the crowns. But really, all of our intentions are to avoid that far, more involved dentistry, the longer appointments, and keep things simple. If I can, a lot of times I'll look at a tooth and I'll tell a patient, this tooth will need a crown. Now, I'm comfortable putting a filling in there, a large filling. I can't necessarily make guarantees on if you're asking me to do the filling, I can't necessarily make guarantees on the longevity, but I believe we can get 2 or 3 years out of it. Especially a lot of the people who live here are just out of college. It's the resort life is kind of an experiment. They've been in dental neglect because they haven't been insured, or they haven't, it's just not a time in your life that dentistry is a high priority, or regular dental visits is a high priority. Likewise, they're kind of making all the money they can to live here and live a resort lifestyle where they can work hard and play hard. And so a lot of people don't have the resources to do comprehensive dentistry. And so we like to provide people options and explain the risks, benefits, and alternatives of all the options and let them choose. Because really at the heart of it, for me, that's what I'd want. I go into a lot of service industries and I'm a know-nothing. And a lot of my patients come in here and know nothing about dentistry. And I always feel like if I wanted to make someone self-conscious about almost anything, I could. But it's really about relating to where they are currently and bringing them on board through a series of appointments. So, comprehensive dentistry is certainly something we can provide, but usually I would say, kind of like what we talked about with sedation, it's almost a stepwise process of this is what's urgent, this is what needs to be done probably in the next few months, this is big picture stuff that we need to start planning for, is kind of how we lay things out for most patients.